I think the most progress that we've seen in HER2-positive early breast cancer in the neoadjuvant setting is the availability of the randomized trials involving addition of pertuzumab to chemo and trastuzumab in that setting. And what has been observed in the NeoSphere trial, for example, is an increase in the fraction of patients who enjoy a pathologic complete response, which in many studies correlates with long-term freedom from relapse. So that's promising data, even though it's not time to event-driven data, but based on a recent FDA guidance, those types of data sets are sufficient for consideration of an accelerated approval designation pending a larger randomized phase 3 trial in the adjuvant setting to confirm that addition of pertuzumab will be impactful above and beyond trastuzumab and chemo. And the Affinity trial is ongoing and will do just that. It is the confirmatory phase 3 trial. So having demonstrated proof of concept efficacy with the pathologic complete response endpoint to meet criteria for an accelerated approval, some additional safety work which was done with a smaller phase 2 randomized trial of different chemo combinations with pertuzumab and trastuzumab, showing no cardiac safety concerns, and the commitment to a large randomized phase 3 adjuvant trial, the Affinity trial that's ongoing. Those three criteria being met, the FDA granted an accelerated approval for pertuzumab in the neoadjuvant setting, 4 to 6 cycles in combination with TCH for 6 cycles, for example, or AC followed by a taxane with 4 cycles of the pertuzumab during the taxane sequence with trastuzumab. So that's really been a breakthrough in terms of practice changing to be sure, but it will need to await the follow-on confirmatory phase 3. If that's a positive study, then I think pertuzumab in the early disease setting will have traction. If the Affinity trial is negative, then I think the Food and Drug Administration would probably withdraw their accelerated approval status for pertuzumab. So everyone's very anxious and excited to see the results of the phase 3 when it becomes available.